Hello, everyone, and welcome to week 14 of MSK Unknown Case Series. This is a phenomenal case that I can't wait to share with you guys. We have a frontal view of the pelvis. And the question I have for you guys is, what's the most likely diagnosis at the sacroiliac joints? Am I showing you a case of inflammatory bowel disease, arthropathy, osteitis condensans, ilii, osteoarthritis, or psoriatic arthritis? If we take a look at the pelvis here, and specifically the sacroiliac joints, notice that there is sclerosis on both sides of the joint, the sacral side and the iliac side. And if we take a further look, there's a lot of lucencies that are on both sides of the joint that don't conform to the shape of bowel. So this is not bowel gas. This is actually frank lucencies along the sacroiliac joint manifested as erosions. So what we have here is a case of bilateral symmetric sacroiliitis. Because in order for you to have sacroiliitis, you have to have erosions, and that's exactly what you're seeing here. This is actually a quite profound case of bilateral symmetric sacroiliitis, probably the most pronounced case of it I've ever seen in my career. So the only two diagnoses that you should really consider highly are ankylosing spondylitis, which is not a choice here, or the other entity that is radiographically identical to ankylosing spondylitis, but clinically completely different, and that would be inflammatory bowel disease arthropathy. So that's the answer here in this case. Now, osteitis condensans ilii would typically manifest as triangular area of sclerosis along the iliac aspect of the SI joints, sparing the sacral aspect. And that's typically seen, it's an inflammatory condition seen in younger females, particularly those who are pregnant. And that's not what we see here, because we see sclerosis on both sides of the joint, and we see frank erosions that we wouldn't expect in osteitis condensans ilii. Osteoarthritis is a consideration, particularly if you think that these are subchondral sclerosis, and if you think that this is subchondral cysts as opposed to erosions. But we'd expect more productive changes like osteophytes, maybe a vacuum phenomenon within the SI joints, which are missing in this case, making osteoarthritis much less likely. And psoriatic arthritis would be a consideration because it is one of the 4 seronegative spondyloarthropathies, which is HLA-B27 positive, just like inflammatory bowel disease arthropathy is. But again, you would expect the sacroiliitis to be bilateral asymmetric. Now, of course, it can also be bilateral symmetric, but it's more commonly bilateral asymmetric. But this is really a case of bilateral symmetric sacroiliitis, making Ibd arthropathy the most likely choice. And actually, the reason why this case is so awesome is if you take a look, superior to the right iliac, when you can actually see surgical sutures here. And this patient had Crohn's terminal ileitis with the terminal ileum resected, and we have surgical sutures here. Again, evidence for their IBD, pathology here. So such a nice case here. So Ibd arthropathy, what you're looking for is you're looking for signs of spondyloarthropathy and peripheral arthritis. And in this case, we have bilateral symmetric sacroiliitis. You can also have arthritis like in the shoulder and the hips. Typically, you wouldn't have arthritis like in the hands like you would in psoriatic arthritis, but you can have arthritis in the shoulders and the hip as well. This is an HLA-B27 seronegative spondyloarthropathy, just like ANK-SPON is, just like chronic reactive arthritis is, just like psoriatic arthritis is. Now, all 4 of these things are clinically different, but radiographically, we typically talk about Ibd arthropathy and ANK-SPON being identical radiographically, and then psoriatic arthritis and chronic reactive arthritis being identical radiographically. Again, this is the bilateral symmetric sacroiliitis. Now, if we had unilateral sacroiliitis, the thing that we'd want to rule out, of course, is septic arthritis, right? It would be septic arthritis and proven otherwise, but this is a case of bilateral symmetric sacroiliitis. You can also have syndesmophytes in ANK-SPON and Ibd arthropathy, which is, an osteophyte or bridging from the corner of the vertebral body to the corner of the vertebral body that represents ossification of the annulus fibrosus of the intervertebral disc. The syndesmophytes are seen in both ANK-SPON and Ibd arthropathy. They're not seen in psoriasis, and they're not seen in chronic reactive arthritis. And a key here is looking for signs of bowel surgery, as we did. In this case, we have surgical sutures here in the right lower quadrant of the abdomen. These patients will typically present with, abdominal pain, weight loss, and they may have, arthritic symptoms as well. So this is a great case of inflammatory bowel disease arthropathy. I hope you learned something. Tune in next week for another amazing high-yield MSK case. Please subscribe to the channel and please share this with all your friends and colleagues. Thank you so much for your attention.